Hello everyone, my name is Bismillah Jan and I have been volunteering with Pakistan Red Cross Society from the last 3 years, and currently I am leading a project on transgender healthcare.
As a result series of lockdown in Pakistan, restrictions on movement have made it difficult to access healthcare facilities, especially for transgender in different areas, which apparently result in undermining access to healthcare facilities. Keep this in mind, the idea had been developed for transgender to learn basic health care services and also to learn first aid for serving the society. Initially, transgender will be trained. That training will equip members of transgender community to help others who may be in need. This step has been taken after it was noted that people hesitate to give first aid treatment to any member of transgender community in case of any emergency. Initially, coordination meeting had been held with concerned authorities, i.e. PRCS doctor and staff, transgender and paramedics, in order to collect information and data on healthcare system in COVID-19, which is used to analyze their views for facilitating the transgender in order to provide the basic health facilities. Later on, field visit has been done to observe the need of learning basic healthcare services for transgender community. During the field visit, their local practices has been observed at community level and also the need of basic healthcare services. During this process, the local transgender community was engaged in local groups discussion to collect information on the need of learning basic healthcare services. After that, their skill will be used to serve the local community in case of any disaster. At first, local transgender community was identified for conducting need assessment, which helped us for design of project. On the findings of that, the local transgender community was engaged for conducting focal group discussion. The main aim of focal group discussion in the community is to encourage the transgender involvement to learn the basic healthcare services, which can be fruitful for the local community. The key informant interviews with Pakistan Red Crescent doctors, paramedics and transgender representatives were conducted to gain information for this project. Findings of the interviews and focal group discussion help us to identify the barriers and significance of learning basic healthcare services. The initial research in phase 1 identified the gaps in learning basic health services. They exist due to lack of knowledge, especially basic first aid trainings, because of the level of education, gender discrimination, low income level, lack of health related institute for transgender. The conducted research in phase 1 proposed to produce skilled transgender within their own community, which will reduce the cost of gender inequality at community level. The trained transgenders will provide a path for other transgender to learn basic healthcare services and use their skills in any emergency situation. The more funding will increase the number of skilled transgender in order to facilitate the transgender at tehsil and district level. Trainer of trainer will be formed to act as an agent in providing the basic healthcare services to other local transgender. Initially, more than 100 transgender will provide training on basic health services, which will include first aid, hygiene promotion, mental health education. An awareness session will also conducted in targeted community for providing basic information on health and hygiene related issues.